Good afternoon to everyone. My name is Arbina and I am here to present one of the most important and most interesting topic of the pediatrics, that is newborn care. As we already know that we all are very interesting in the child. We are all interested in caring of child. We are all interested in playing with the child. So that's what it makes a little bit interesting. So I'll be taking care of that class today. If we talk about the newborn, so we get an idea that the newborn is which is newly to the world, which is a new type of thing which we are experiencing. That is the neonate that's coming after the birth, and the newborn care. It's very important. It's very essential for everyone to take care of. The newborn care, it's important for not only for the mother and the parent, but it is very important who are taking care, like the nursing personnel or the healthcare provider who are taking care for the child as well. The newborn care, the general objectives we'll see for this. The general objective, the group will be able to understand about care of newborn and able to apply theoretical knowledge to the clinical practice. Yes, you need the practice to be maintained. You need to get through the practice what you have studied. You need that in your clinical areas. Specific objectives for this newborn care is like the group will be able to and the students will be able to understand the care of newborn, that is immediate as well as the routine care. They discuss about the warmth, the care of the eyes, the care of umbilical cord as well as the care of the skin. Then the students will be able to discuss the immunization, the observation, breastfeeding, what are all comes inside this topic. The students will be happy to understand. They will be interesting to know regarding those things. The healthcare provider must know, or the healthcare provider should be expert in providing the care to the newborns. They should already have the knowledge, theoretical as well as the experience in clinical areas. Students will be ready for that thing and they will be ready for taking care of the baby while they are in the clinical areas. I will come to the introduction for this newborn baby or the newborn care. The essential care for the newborn baby, it's very important, and the neonates, it is for neonates, it is to be provided, especially the best provider is mother. We call it as the best provider because the mother is the only one who can take care of her baby very well. None other can, but it should be under the supervision of the personnel or the healthcare provider. As we know that about 80% of the newborn babies, they require minimal care because the normal term baby should be kept with the mother as soon as possible after the birth and not in the separate nursery. Rooming in should be encouraged for the mother because the rooming in, it promotes the best protection, it promotes the best coating for the baby when the baby is near to the mother, and the mother feels very confident, the mother feels like happy, and she feels like comforting when the baby is near her. And not only it provides the protection, but it provides the essential and the emotional bond for parent as well as the baby. The nursing care of healthy newborn baby after the birth should be provided as immediate care as well as the daily routine care. And if I'll tell you that this neonate care, if we are giving to the baby, it should be explained to the mother as well, because if the mother is experiencing the baby at the first time, she should know how to care about the baby and she should be confident enough in taking care of the baby. This newborn care I'm talking about is for the healthy baby who is term, and for them that minimal care is provided, and for the baby who are in need of special care, who need a special nursery or who need the intensive care, they are being admitted and they are being taken care in a special way. And I'm talking about the healthy neonates. And healthy, who is healthy neonate then? The healthy neonate will be the one who is born at term between 37 to 42 weeks, and he should have or she should have the birth weight average in 2.5 kg to 4.5 kgs, and the birth time, the baby who is healthy and term, he cries immediately after birth and quickly adapts to the environment. And the baby who is new to the world has many more things to adjust with the environment. And if you'll see, the baby who is new to the environment has to adjust with the temperature, has to adjust with the air which is present inside the room, which is present inside the environment, and the baby should be taken care of everything he is new to. Then we'll move to the immediate basic care of the newborn. As I told that immediately if you are giving the care, we should know what are the things we are prioritizing before that, and then we are going to the daily routine care. In this immediate basic care, a majority of babies, they cry at birth and they take spontaneous respiration. Because as they are term, they don't have any problems, they don't have any issues in adapting the environment, so no resuscitation is required for most of the babies who are born. These healthy normal neonates need only warmth, they need the breastfeed, they need the care to the skin, they need the clothing well, they need the early detection and anomalies, early detection of the anomalies, as well as the protection from infections and any kind of injuries. After cutting the umbilical cord, aseptically the baby should be kept dried, and he should be kept wrapped, and he should be kept very warm and free from all kind of septic procedures. Identification tag should be tied to the mother as well as to the baby, and a recording to be done accurately that when the baby is born, the time, the date, and as well as the sex, examination of any kinds, like which are findings during the time of examination, presence of any kind of problem, everything should be mentioned or everything should be recorded during the time in the delivery record sheet. The mother and baby both should be transferred to the ward, usually after 1 hour of the observation in the delivery room, and when the condition is fine for the mother after the exhaustion of the labor. Sick or at risk neonates who are not well, who are not the normal or the term babies, they should be given a special care in special settings. In immediate care, what all the things come into our minds that we should go through. The first one that comes is APGAR score. You might have heard and you might have any kind of idea regarding that, right? So APGAR score, if we'll talk about the APGAR score, before seeing the score and everything, we should know what it really is. The APGAR score, it is a quick test which is performed on a baby after the birth, and it is done over 1 minute or 5 minutes after the birth, or the 5 minutes of the first time. If we'll see the APGAR score, where it comes and how does it name APGAR? It has been given after a name of its creator, Virginia APGAR, in the United States, and the acronym for this was used as APGAR, and it has 5 components, like A for appearance, then second comes for aspiration, then the next comes for P, it's for like if you'll see the color of it comes in, color comes in the this one appearance, then comes the respiration, then comes the pulse, P for pulse, heart rate we are reading, and then comes the reflex response, and one more is muscle tone. So these are all coming on the points given 0, 1 and 2. So the scale for this APGAR score is from 1 to 10, and the score which is given as 7 to 10 as compared as healthy and normal, it indicates that the baby is going well or adjusting well to the environment. And if it's below 7 or below 7 it's considered as mild, and below 4 it's a severe condition, the baby needs special care. And this 1 and 5 minute of APGAR score, it helps the healthcare provider, it helps the the practitioner who is dealing with the baby, it helps the person dealing with the things that the baby, whether it is establishing the things in environment, whether it is tolerating the birth, whether it has tolerated the birthing process, whether it is adjusting to the environment where the baby comes as new. Fine. If we'll give the APGAR score, you have to see what the conditions baby is coming under. If it's 0, then the things will be like, as I told the scale of that APGAR score you have to measure. And if we'll come to the daily routine care of the neonates, you need to see what are the things you have to take care of them in a daily routine basis. The major goal for nursing care of the newborn is to establish and maintain the homeostasis, that is the stability in the normal physiological status. Okay, if we'll see the daily routine, what are all the things which are coming under this daily routine? It's, as I already mentioned before, that warmth, observation, breastfeeding, then what comes is immunization, and what comes under this is other care regarding skin, umbilical cord, and what all we'll see in the coming slides. If we'll see the warmth, why we need to give the warmth to the baby? Do you have any idea? It's because if the baby is not kept warm, if the baby is not clothed properly, what will happen is the baby will go to a hypothermia, and it will lead to the further conditions. So what are we doing there? We have to do is that warm the baby by keeping the baby immediately under the radiant warmer, or by keeping the baby warm by clothing first. Before that, dry the baby nicely and clothe the baby, and keep the baby on the side of the mother. Then that the mother's body temperature will keep that baby warm, and baby can be placed in skin to skin, that is, if we call that as kangaroo mother care, skin to skin care. It's to be given to the baby and mother, and it helps baby facilitate breastfeeding. And bathing at first day is avoided to prevent baby from hypothermia. Baby should be clothed nicely, he should be dried, and he should be done all the things which I explained. Then we'll move to the breastfeeding. Breastfeeding, one of the important part, it's one of the important thing which we have to do during the care of the newborn, and it should be facilitated immediately after the birth. The breastfeeding, before we come to the things what we do in the breastfeeding, we should know the breastfeeding, what it is. The breastfeeding, it is the feeding of the baby, feeding of the infant or the child during the 6 months directly from the human female breasts, that is while lactation. You might know the lactation process, so I'm not going there. So the lactation which is given by the mother, it helps baby keeping warm, it helps baby being free from the infections, and it helps not only baby but it helps the mother in certain conditions as well. So the baby should be put to the mother's breast within half an hour, or as soon as the mother is recovered from the exhaustion of the labor. And colostrum feeding especially should be established, as well as the demand feeding should be established during the time. Mother should be informing about the techniques, because the techniques, they are very important during the breastfeeding. Mother should be explained regarding them. Mother should be told that how to breastfeed the baby, in what conditions and where and how. These are things which are to be explained. And demand feeding, as I already mentioned, it should be established, because they should be told that formula feedings are not at all good for the not at all good for the babies, right? So the mother should be explained, not only the mother but the baby's family as well should be explained regarding the matter. Skin care and the baby bath, as I told, that under the care these all things are coming. The baby must be cleaned of the blood, mucus and meconium. Do you know the coating over the body of the baby, which is naturally biofilm over them? It's called the vernix caseosa. It's one of the important coating that is naturally found on the baby's skin after birth, and it helps giving protection to the baby. It helps giving baby an adjustment to the new environment, so it should not be washed off vigorously. So no vigorous attempt should be made to remove it, and it provides the protection to the delicate skin. Baby bath can be given in the hospital, but in some conditions, if they are fair for the baby, and if not, then sponge bathing is enough for the baby. Bathing should be avoided in open places as well. During winter months, the baby should have the sponge bath only, because it may lead to the hypothermia as well, and the conditions will not be feasible for the baby. So sponge bath, clean the baby with the sponge bath, that's enough. Oil used that is coconut oil or olive oil, you can use after 3 to 4 weeks of the age. Oil massage is to be given to improve the blood circulation as well as the muscle tone, and oil massage should be given before the bathing, and baby should be exposed to the sun rays for the vitamin D and warmth, and the talcum powder after bathing should be used for groins, buttocks and all the creases over the body. Care of the umbilical cord. If you'll see the umbilical cord, what is it? The umbilical cord, it is a tube connecting the mother with the baby. The connection between the mother and the baby during the pregnancy or during the fetal period, it helps in providing the oxygen and food from the mother towards the baby and the waste products from fetus to the mother, and during the fetal period this gives a communication between a mother and the fetus. And this umbilical cord, after the birth, it has to be cut. The cutting should be done like the cord should be cut 2 to 3 inches from the navel with aseptic precautions to be maintained, and during the delivery it should be tied with the cotton thread or disposable plastic clip. No other things are allowed to use. It may spread the infection to the umbilical cord and to the baby, so the careful clipping of the umbilical cord should be done. And this umbilical cord must be inspected for bleeding afterwards, which commonly occurs due to any shrinkage of the cord, and most oftenly the dressing should be loosened or it shouldn't be over the umbilical cord till it gets dried, and cord should be kept open. And this normally the umbilical cord, it falls down from 5th to 15th days, so family should be, or the parents should be explained that you shouldn't pull it off, or in any circumstances while it doesn't fall by its own, you should report to the doctor, and you shouldn't use any kind of substances or any kind of procedures at home. And application of any kind of dye or any kind of junction violet is not at all allowed to clip the cord. Then we'll move to the care of eyes. Care of eyes, as we already know, after the birth, the mucus, the blood, the caseosa will be all over the body, and after the baby is dried and kept clothed, he should be taken care, or she should be taken care of the eyes as well. The remaining mucus, remaining any blood or any kind of stains over the eyes should be removed with the help of cotton, and it should be sterile cotton swab, and that is to be used just for one slide or one stroke. It should be used only once, and then it should be discarded for the next stroke. From the outside to the in, it should be done with another separate sterile cotton swab, and same is done with the another eye, and it should be separate. Both the things are to be done separately. For the one eye separate, and for the another eye it should be separate. And it should be the application of cordial or any kind of eye drops or anything should be avoided during the period, and the eye should be observed for any kind of allergies, redness, the excessive tearing of early detection, and other problems as well. Clothing of the baby should be dressed with a loose, soft and cotton cloths. Large button synthetic frock or plastic types should be avoided, and the triangular soft, and it should be the napkin in a triangular form, which is to be kept for the baby, and it gives a relief, it provides relax to the baby. The cloth should not be tight, especially over the abdomen or the neck or to the navel area, and in winters you should take care of the clothing as well. The woolen clothes are much better for the baby during the winters. The general care, if we'll talk about, is we have seen all the things like eye care, umbilical cord care. Separately we have seen the things which are coming under the care. Now if we'll see the general care towards the baby, the newborn should be kept with the mother for continuous rooming in as well as in a ventilated room. As I already told, that it helps both of them in bonding as well as in the establishment of the breastfeed. Baby should be handled with care, and it should be in a gentle approach after hand washing, and no one who is not who has not done hand washing, or who has not sanitized, it should not touch the baby or should not handle the baby. And no visitors who are any infected person who have any kind of disease shouldn't visit the baby in the room, or baby should allow to sleep in a spine position. Why? Because the spine position, it helps in good breathing, and it will prevent also from the infant death syndrome. General cleanliness is very important for mother as well as the family as well as the baby, and the environment or the surrounding of the baby should be cleaned as well. In observation, what are all the things we need to observe? The baby should be thoroughly observed, and he or she should be observed twice daily for early detection or any kind of abnormalities. And the temperature, pulse, other vitals should be observed during the period, and the urine pattern, stool pattern, sleeping pattern also are to be observed. Mouth, eyes, cord and skin should be looked for any kind of bleeding, any kind of infections, and they should be reported. If we'll come to the weight recording, it's one of the most important part. Weight has to be recorded because assessing the daily weight helps in the healthy growth and development. To assess the daily weight gain in healthy term babies, and it is to be said that it should be in average like 30 grams per day for 1 month, and it will be 20 grams per day for next month, and then it will go 10 grams per day for a year at least. Then it will grow as it is growing. And most infants, they double their weight by 4 to 5 months, but in first weeks of the life of the infants, what will happen is the physiological loss will occur for the babies. Why? Because the blood will be shed off the mucosa, cellular blood volume will be reduced, and not only that, the meconium passage and other things, they will lead to the physiological loss in first days of the life, and then the baby, he gets back or he regains it after some time or in coming weeks, 4 to 5 weeks of the life. With adequate breastfeeding, definitely the majority of the babies, they grow well and they regain the weight within first days itself. Not only weighing is important, but the anthropometric measures, you might have known, right? You might have heard that the anthropometric measures, they are also one of the signals, they are one of the indications that are giving us regarding the health of the baby, the growth and development of the baby, right? And anthropometric measures, it includes the length of the baby, that is to be performed from the top of the head to the heels. Then head circumference, it is to be measured, and the head circumference, it is to be measured from the forehead, and it should be 2 inch or 3 inch above the eye level, and then it should go to the back side of the head at the highest prompt area of the back area of the head. Then it comes to the forehead, and it is to be measured, and the chest circumference as well, it should be measured at the navel level. Next we will move towards another part, that is immunization. One of the important care part, one of the important signal or one of the important indication that is to be given, because the immunization, as we already know, it is the preventable part which is helping to prevent the babies from the morbidity or the mortality. And the immunization, it should be known that what immunization is and how the immunization schedule is running throughout the world and especially in the India. This immunization, it is one of the practice that's performed that the baby is getting immune or he is getting resistant towards the infections or towards the other viruses, because the infection causes that the infection which is caused to the baby, it leads to the very crucial and the fatal life-threatening problems. Immunization is just by giving the vaccination towards the baby or injecting a vaccine inside the body to grow immune system or to grow immune against all those diseases. It should be given within first weeks of the life. The mother should be informed about the national immunization schedule, and explanation should be given about importance of complete immunization and all possible reactions of the vaccine after the immunization is done. That the normal things which occur usually after the immunization, the redness or the fever, or the baby may have this one crying, more crying. So these things should be explained to the mother and the family. And the special part, that if the immunization is left, if the immunization is skipped, what happens to the baby? So what are all the harmful effects to the baby? These all things are to be mentioned during the immunization. If the baby is in institution or he delivers in the institution, then the baby should be immunized with BCG vaccine, 0 dose of polio vaccine, and hepatitis B vaccine. Vitamin K, it is given at the birth itself because it promotes or it prevents from the neonatal hemorrhage. And if it's outside or in home, then babies are to be given or immunized in any other institutions which are nearby. Follow-up and advices. In follow-up, each infant should be followed up at least once every month, and once every month for first 3 months, and then subsequently 3 months interval till 1 year of the age. Follow-up is necessary for any kind of assessment of growth and development, for early detection and the management of health problems which are seen during the period, and health education especially given to the parent and family regarding the exclusive breastfeeding, immunization, hygiene maintenance, and rooming in, as well as the follow-up. It should all be explained or advised to the family before discharge or before giving any kind of treatment. Harmful cultural practice must be avoided. There are traditional things which are to be given while a baby comes home. What substances or unclean substances are to be used for the baby, like powder cakes or any kind of oils that are to be used for the baby should not be allowed at all. And how this one care at home should be discussed and demonstrated to the mother and the family, like breastfeeding, immunization, and other things which are to be taught to the mother and the family during the period. And finally, if all things are given to the mother, all things are given to the babies, and at last what we all do while the mother is getting discharged with the baby as well, we are giving some advices at the time of discharge. We are suggesting some of the things which will be helpful to the mother, which will be helpful to the baby, and which will be helpful to the family as well. So what do we advise at the time of discharge is regarding the breastfeeding, the most important part. The breastfeeding, the techniques of breastfeeding, and how often to give breastfeed, and when to give the breastfeed, and what are all the things to be avoided during the breastfeed. These all things are to be mentioned. And if we'll talk about the immunization, so I already mentioned that the immunization should be mentioned over the discharge card. What are all the things or what are all the vaccines given at the time of birth, and when to give the next. Because most of the mothers who are totally unaware of the things, so they should come to know while seeing the cord or while showing cord to someone. And the next one, the follow-up date for the babies while discharging, and it should be given to the mothers that after some period of time assessments of the baby should be done at home, and you should report all the things what you see in the baby which is abnormal. And the danger signs especially should be documented, and mother should be educated to recognize all the danger signs while assessment. She should know the baby if he's having any kind of difficulties during the breath, if he's having the temperature more than 37.5 or below 37.5, and if the baby has difficulty in feeding, if the baby is not having a good latch, or if any kind of lethargy, convulsions occur in the baby. So the mother should know all the things, because you might be taking care of the baby just for some days in the hospital, but the later or the remaining time mother only has to spend with the baby. So all the things should be explained, what are all the things comes in the daily routine care, it should be explained and mentioned to the mother, and they grow as a healthy and a normal adults. So that's it. Hope you liked the topic and hope you enjoyed it and you might understand it nicely. Go through the topic again and find the new things and tell me. Thank you so much.